have been a number of publications, and to me, two stand out. I think the first one was the large-scale concordance study that we did. It took many years to bring that to fruition, but we got a large sample of osteopathic students who took both the USMLE Step 1 and Step 2 exams, as well as COMLEX Levels 1 and Level 2. I think that study is important because it shows that we can actually concord the scores reasonably well. And unlike previous studies, a nonlinear model was applied. So what had happened before is those estimations of what person's Step 1 or Step 2 score based on COMLEX Level 1 or Level 2, I think we're somewhat in error, essentially mostly at the extremes. So this gives program directors an opportunity to look at, what would these scores look like if we put them essentially on the USMLE scale. And I think that was one of the big ones. The other one that comes to mind, the Coalition for Physician Accountability convened a review, a UGME to GME review committee, to look at how to make the transition to residency a little bit easier. Dr. Gimple put together a synthesis of that was published in the Journal of Osteopathic Medicine in 2022 that looked at some of the recommendations of that particular review committee and put it in a kind of a nicely, tightly bundled document and discuss some of the problems of implementing these recommendations and how it could affect medicine in the future. In addition to the published research studies, there's a number of presentations as well last year in 2022 at the American Association of Colleges of Osteopathic Medicine meeting. I know there was a presentation done on Level 3 and kind of the validity evidence that says this is really measuring those fundamental osteopathic those fundamental osteopathic skills. And so those types of studies that look specifically at the structure, the validity, the reliability of COMLEX examinations, I think are very important to the profession. Assessments are always evolving. You look at Level 3, where the CDM items were incorporated a couple of years, 2-3 years ago. Going forward, I think it's a very exciting time. With the indefinite suspension of COMLEX Level 2 PE a couple of years ago, the convening of the special commission, their report, the board actions, and the new core competency capstone pilots. I think that's really important because research on these pilots related to clinical skills assessment is only going to bring the whole field forward. And one can envision lots of different types of research studies to look at what should and can be measured in a COM-based clinical skills assessment. So, these assessments just staying the same all the time is not happening. And even for Levels 1 and Levels 2 in the current multiple choice formats, the item writing has changed, the vignettes, the addition of graphics, videos, etc. And so when students say, what does this really have to do with my progression in medical school or my licensure, we can say as the NBOME that these assessments are evolving to capture those things that really matter in terms of the osteopathic profession. Looking at how to identify enemy items being those items where they shouldn't be present on the same exam. So some of the psychometric research to look at what items work well in particular exams, how they should be scored, some of the efforts to look at automated scoring of the write-in responses for the CDM items. And that some of that gets published and some of it gets published later on, once all the research is done. But the efforts done by NBOME to look at some of these particular issues, try to make the exams more efficient, ensure that they're actually the items or cases or CDM types of items are measuring the correct constructs. How do we develop new types of items? Do these types of items work, etc. The big one, though, that's coming up is the core competency capstone, C3DO, where I think we'll have the opportunity to look at a lot of measurement and assessment issues related to clinical skills. So, we had the Comlex level 2 PE was indefinitely suspended, but maybe there's a more efficient or effective way to measure some of those skills that are important to the osteopathic profession. I think it's very exciting to see that we'll have the opportunity to look at some of these things, because moving the assessment field forward, especially for osteopathic medicine, is very important.